The thought of undergoing the dental filling could be quite daunting for many. Perhaps it's because they are scared about the procedure or concerned about the healing process. It's essential to understand the basics of what you can expect when receiving a dental filling. Then, what will be the procedure for recovery after receiving dental fillings? Let's take a look. 1. Immediate post-procedure care. When you receive a filling for your tooth, it is possible to experience discomfort in the affected region as a result of the local anesthesia utilized for the procedure. You should be careful in drinking and eating right after receiving a filling in order to avoid slipping and biting the tongue or cheek. To prevent any discomfort, it's best to limit your intake to soft foods and steer clear of hot or cold beverages until the numbness has worn off. In addition, you must comply with any after-procedure guidelines provided by the dentist. For instance, not eating hard or sticky food items that can cause the filling to slip away. 2. Sensitivity and discomfort. The majority of patients experience sensitivities or pain during the first few days after an appointment for a dental filling. The symptoms could include sensitivity, extreme temperatures or temperature variations, and pressure during a bite and a mild ache in the affected tooth. If you are experiencing discomfort, it is possible to try over-the-counter medications for pain relief, including acetaminophen and ibuprofen. Beware of using aspirin because it could cause more bleeding around the affected area. If you're experiencing constant or intense pain, be assured to speak with your dentist to get further advice. 3. Adjusting to the new filling. While your mouth adjusts for the change in filling, you might notice changes in your bite and the way that your teeth are brought together. This is normal and could be handled by your dentist via simple adjustments to the size or shape of your filling. It's crucial to share any problems you're suffering with your dentist to ensure they are able to make any necessary modifications to ensure you're comfortable as well as the correct function of the filling. 4. Maintaining oral hygiene. Maintaining a healthy mouth is vital to ensure the best recovery possible after having a filling in the dental cavity. You must continue to brush and flossing frequently, but be mindful of the area around your filling in order to keep the filling from slipping out or damaging the filling. The use of a fluoride toothpaste or mouthwash may also aid in strengthening enamel as well as reduce the possibility of tooth decay within the filling. Cleanings and dental exams regularly are important in order to assess the condition of fillings and take care of any issues before they become serious in the process. 5. Monitoring for signs of complications. Even though complications that result from a filling for a tooth are uncommon, but it is important to be aware of indications that signal a potential trouble. They could be a sign of persistent inflammation, pain, or sensitization to pressure, or changes to the appearance that the tooth filling. If you are experiencing any of these symptoms, it is important to call your dentist as soon as possible to discuss any issues that could be causing them and to prevent future complications. Recovering after having dental fillings are generally easy and quite non-invasive. Following the instructions on post-surgical care and addressing any discomfort or sensitivity, ensuring an excellent oral hygiene routine, and keeping an eye out for indications of problems, you'll be able to make sure that your recovery is smooth as well as a long-lasting and successful dental filling. Make sure you communicate any concerns to your dentist. Also, schedule regular appointments to keep your dental health.